Have you ever asked yourself, why do I always have UTIs? By the way, what is UTI? In simple form, UTI means urinary tract infection. So this is not the same as STI, which is a sexually transmitted infection. So in this case, it's an infection of the urinary tract. That's the waterworks. Now, let me quickly run you through how UTI happens or occurs. So UTI is caused by a bacteria we call E. coli. So normally, this bacteria is found in the rectum or in the anus. That's the back passage. So UTI happens when we transfer this bacteria from the anus into the vagina or the urethra, which is the passageway for urine. So if we transfer this into this urethra, it causes an infection in the urinary tract. So how do you know if the symptoms you have are symptoms and signs of UTI? The most common symptom or sign of UTI is what we doctors call dysuria. In simple form, it is pains when you wee. So if you're having this kind of a burning feelings or pains when you wee, you might be having a urinary tract infection. The second possible symptom of UTI is what we call frequency. You discover that you have more and more urge, more and more need to go and urinate. And shockingly, when you actually go to urinate, you will find out that the amount of urine you pass out is not really much. Sometimes you have this urge to go and urinate as much as 3 times or even 4 times in 30 minutes. That's what we call increased frequency. The third possible symptom of UTI is what we call increased urgency, which simply means that when you actually have the urge to urinate, when you have this urge or this need to wee, you can't hold it at all. You have to go in there and there. Otherwise, you might even wet yourself. Other possible symptoms and signs of UTI are pains in your lower tummy, pains in the side of your tummy, we call the flank, and also back pain can all present as UTI. Okay? Now, why are women at more risk of having UTI when compared to men? The reason for this is because the anus, the vagina, and the urethra in women are very, very close to each other. So it is easy for this E. coli, this bacteria, which normally lives in the anus, to be transferred to the urethra, causing the infection. Whereas in men, the distance is quite much when compared to women. That is why men don't often get UTI as much as women do. Okay, apart from this, what other risk factors can make you get UTI? The most common risk factor, again, of having UTI is washing from back to front. Remember that when you wash from back to front, you transfer this bacteria from your anus into your urethra, causing the infection. So avoid washing from back to front. Instead, you wash from front to back. Second possible risk factor for this UTI is sexual intercourse. When you have sex, the chance of having UTI is also more, especially if it's a new partner. But how can you avoid this? After intercourse, go and urinate. When you do so, it helps you wash away the urinary waste or the urinary pathways, and also keeps it clean. Other possible risk factors for UTI is when you withhold your urine for too long. It keeps you at risk of having UTI. So once you have the urge to wee, try as much as you can to let it go, to wee comfortably. Okay, the next possible risk factor for UTI is diabetes. Those who have diabetes are at more risk of having UTI. Also, those who have HIV are at more risk of having recurrent UTI.